The information derived from job analysis is vital for establishing the relative worth of jobs within a company through a systematic process called job evaluation. The four most common types of job evaluation are job ranking, job classification, point factor, and factor comparison. The first two approaches, job ranking and job classification, are qualitative approaches. Point factor and factor comparison are quantitative approaches to job evaluation. Next, we give a brief overview of the classification method of job evaluation. The job classification approach involves developing broad descriptions for groups of jobs that are similar in terms of their tasks, duties, responsibilities, and qualifications. Job descriptions for a particular job are then compared with the classification description, and a decision is made about which description best fits the job. A wage range is attached to each classification, reflecting the relative worth of the jobs slotted into that classification. In the federal government, the classification levels are referred to by the prefix GS, which stands for General Schedule, followed by a number. Naturally, the pay range is higher for jobs with higher GS numbers than for those with lower numbers. More senior jobs fit into an entirely separate pay schedule. Sometimes, managers want to reclassify jobs so they can give a particular employee who merits it a large raise or because the job duties have changed. The managers can then compare the revised job description to the classification guide to determine which grade that job falls. The classification description can also be used as inputs for preparing the new job description. One criticism of the job classification system is that the parts of the job being evaluated might fit into one job grade in the system, whereas other parts might fit into another grade. A decision then has to be made about which classification is most appropriate. Because the pay range will differ depending on the decision, the outcome of the evaluation process is extremely important.